Mass testing in Liverpool was popular and effective. Hundreds of people were found to have the virus even though they had no symptoms, and case rates have fallen by 3/4. The strategy is now being rolled out to other hotspots, with the Health Secretary suggesting it's the way out of the new tougher Tier 3 restrictions that start after lockdown ends.
The light of dawn is on the horizon. It's the moment to stand firm until the morning, so we can look back and see clearly that everything we gave and everything we did, it was not for nothing, but so we could save lives and build back better for everyone.
Testing of 2 million university students has also started to reduce the risk of them taking the virus home to vulnerable relatives at Christmas. Josephine has been in Manchester, until recently one of the worst affected areas in England.
I might be able to stand 2 meters away from my grandpa and say hi. But whereas if I don't take the test, then that would make me much more on edge, because I don't want to make my grandparents ill.
Lockdown has slowed the spread of the virus, with infection rates falling by 1/3 and even more in areas of the north that were in Tier 3. Researchers at Imperial College found that across England, 72,000 people a day were being infected in mid-November, down from 100,000 a day at the end of October. The national infection rate was about 1 in 100 people. But there were big variations around the country, with the hotspot shifting from the north of England to the West Midlands, where 1 in 64 people were infected. All now hangs on the new stricter tiering system.
If the new tiering works, we will avoid any future lockdowns, and if it doesn't work for whatever reason, then a third wave and possibly an additional lockdown becomes more likely.
But while infection rates in adults are falling, the study shows they're still rising in children. Schools have stayed open during lockdown, and term ends less than a week before people are allowed to gather for Christmas.
We really can't deny now that school-age children do get infected for a while. We hope that they might not be as susceptible, but that's certainly not true, especially for secondary age school kids. So we do need to acknowledge that that's a vector that can bring the virus into our homes, and we need to be all the more careful, especially as we might be close to the finish line with a vaccine on the horizon.
The vaccines are coming, but it'll be well into next year before they make a difference. Until then, testing and tough restrictions, however unwelcome, are likely to be the best bet for holding the virus in check. Thomas Moore, Sky News.